waking up at 2 a.m., then 4 a.m., rushing to the bathroom, only to experience a weak, frustrating trickle. If this sounds familiar, you're not alone. An enlarged prostate, or BPH, is one of the most common issues for aging men. According to the NIH, about 50% of men have an enlarged prostate by age 60. And by age 80, a staggering 90% of men will deal with this condition. But the big question everyone asks is, can you simply eat a specific food to shrink it back to normal? I have good news and bad news. Let's start by understanding what's actually happening inside your body. Imagine your bladder as a flexible water balloon, storing liquid until it's time to empty. Attached to the bottom of this balloon is a hose, called the urethra, which carries the urine out. Now, your prostate is a small, walnut-sized gland that wraps perfectly around the top of that hose, like a ring. In your younger years, this ring is normal-sized. It helps produce fluid for semen and causes muscle contractions. But as men age, this prostate ring naturally grows thicker and tighter due to hormonal changes. As it enlarges, it squeezes the hose. The passage becomes incredibly narrow, restricting the flow of urine. Because the hose is squeezed tight, the water balloon above has to work twice as hard to push liquid through. Over time, the bladder muscle becomes exhausted, thick, and highly sensitive. Which brings us to a massive misconception. The size of your prostate is not the only reason you can't pee. That's right. Many men have massive prostates, but zero symptoms, while others have slightly enlarged prostates, but severe bathroom urgency. Why? Because of the bladder's elasticity. An irritated, overactive bladder is often the true culprit behind your symptoms. When the bladder is nervous, it forcefully contracts and sends panic signals to your brain, even when it's barely full. Have you ever driven your car, turned onto your street, and suddenly felt a violent, uncontrollable urge to pee? That is a classic reflex of an overactive, nervous bladder muscle, not just a prostate blockage. So what makes this balloon so angry? Several everyday habits act as chemical triggers for bladder spasms. Caffeine and alcohol are major diuretics. They rapidly fill the bladder while simultaneously irritating its lining. Spicy foods can also act as inflammatory agents in the urinary tract, increasing the sudden urge to go. Even stress and anxiety tighten your pelvic floor muscles, putting extra mechanical pressure on the entire urinary system. And don't forget the temperature. Exposure to cold weather triggers a reflex that makes the bladder contract faster. Sometimes, the prostate doesn't squeeze the hose, but instead grows directly upwards, poking into the bottom of the bladder. This specific shape hits the exact nerve center responsible for the urge to pee, causing constant false alarms. In rare cases in older men, the prostate actually becomes too soft. When the bladder pushes down, the prostate simply collapses. This collapse blocks the exit entirely, proving that elasticity matters just as much as size. So, how do we calm this system down? Let's talk about the nutritional science that actually works. First, the bad news. If your prostate is heavily enlarged, no magical supplement will instantly shrink it by half. Let's look at cruciferous vegetables, especially broccoli. It contains a powerful compound called sulforaphane. Studies show sulforaphane has a highly protective effect against prostate cellular damage and reduces localized inflammation. Next up, tomatoes. They are packed with lycopene, an antioxidant famous for prostate health. But there's a catch. Eating raw tomatoes won't give you the full benefit for your prostate. You must cook or simmer the tomatoes at around 80 degrees Celsius or 176 degrees Fahrenheit. Heating them converts the lycopene into a cis form, making it incredibly easy for your body to absorb. Medical data links both benign prostate enlargement and prostate cancer to severely depleted zinc levels. We aren't entirely sure if the disease causes the drop in zinc, or if low zinc causes the disease. Either way, maintaining healthy zinc levels through pumpkin seeds or lean meats is a highly protective strategy. Lastly, flood your body with polyphenol, powerful antioxidants found abundantly in green tea. Specifically, the EGCG compound in green tea, along with fresh pomegranates, helps neutralize inflammatory free radicals in the pelvis. Remember the rule: colorful is healthy. A vibrant, plant-rich diet directly influences your urinary tract's aging process. While adding good foods is great, removing the bad ones is even more critical. Meet your prostate's worst enemy. Trans fatty acids. These are artificially hydrogenated fats found in fast food, commercial pastries, and frozen pizzas. Trans fats are highly pro-inflammatory. They send chemical signals that promote swelling throughout your entire body. This systemic inflammation targets the delicate blood vessels in your prostate and bladder, worsening your symptoms dramatically. You should aggressively cut these hardened fats out and replace them with high-quality, cold-pressed olive oil. Olive oil contains oleic acid, which actually soothes inflammation and supports smooth blood flow in the pelvic region. Now, what about fasting? Can starving the body shrink the prostate gland? Interestingly, a clinical pilot study observed that prolonged fasting did actually reduce overall prostate volume in participants. The body likely broke down excess tissue for energy. However, there was a major side effect. During the fasting period, the men's testosterone levels plummeted significantly. And obviously, you cannot fast forever. Once normal eating resumed, the long-term benefits were questionable. Warning: always consult your doctor before attempting extreme fasting, especially if you have underlying conditions. Excess visceral belly fat produces inflammatory hormones that constantly bathe your prostate in stress chemicals. Losing just 5 to 10% of your body weight can relieve massive pressure off your bladder and pelvic floor. Beyond food, there is a physical therapy technique recommended by the Mayo Clinic for men with BPH. Kegel exercises. Yes, they aren't just for women. Men have a pelvic floor hammock that supports the bladder. By strengthening this muscle, you give the bladder better support and improve your ability to hold urine. To find the right muscle, try stopping your urine flow midstream just once. That's your pelvic floor muscle. Once you've identified it, practice squeezing and holding that muscle for 3 to 5 seconds while your bladder is empty. Do this 10 to 15 times, 3 times a day. You can do it while sitting at your desk or driving. Combine this with double voiding. Pee once, wait a few moments, and try again to fully empty the bladder. Also, limit your fluid intake about 2 hours before bed to drastically reduce those frustrating midnight wake-ups. In summary, you can't magically shrink a large prostate overnight just by eating a salad. But by avoiding trans fats, managing stress, and keeping warm, you can stop the bladder from overreacting. Load up on cooked tomatoes, broccoli, green tea, and healthy fats to fight internal inflammation naturally. And start training your pelvic floor to regain physical control over your urinary tract. Aging is inevitable, but suffering in the bathroom is not. Take charge of your prostate health today. If symptoms persist or worsen, please don't hesitate to see a urologist for proper medical evaluation. This video is for educational purposes only. Please consult a healthcare professional before making health changes.